So we'll start with a HESI, or I'm sorry, we'll start with a Kahoot. Sorry, my screen did something I wasn't expecting it to do. Just 1 second, guys. Still on Zoom. Zoom meetings. Okay, I'm gonna go ahead and get started here. If you're still joining, let me know and I can wait 1 more second. Okay. Heck. What is going on? So a toddler has a Broviac catheter. While playing with the IV tubing, it gets disconnected. What is the priority nursing action? Clamp the catheter, position the child sitting up, turn off the IV pump, or flush the catheter with normal saline and heparin. All right, so most of you got this right. So clamp the catheter. So obviously, if it gets disconnected, blood can back out. The first thing you're going to do is clamp it. Then you're probably going to flush it with normal saline and heparin, but your priority first action is to clamp the catheter. So an infant just had cleft lip repair surgery. Why should you minimize crying during the postoperative period? Crying causes dehydration, crying interferes with sleep, crying stresses the suture line, or crying causes decreased oral intake. Right. So good job. You're going to be worried about any damage to their surgical site. So you want to kind of minimize any pressure inside the mouth. So that's the main reason you're going to try to decrease crying. So a child has a central line for treatment of ALL and has a fever of 103. What intervention is most important? Obtain a CBC, obtain blood cultures from the central line, administer an antipyretic as ordered, or take temperature every 2 hours. So this was a little bit of a mixed bag. So this is one of those priority questions. So you probably are going to be, getting a CBC and you're going to be getting a pyretic, but you need to make sure that you have a good culture so the doctor can give the best antibiotic to treat that infection. So you need to make sure that, get this culture drawn and sent to the lab so that you have like a baseline culture and sensitivity to target your antibiotics. So a child is scheduled for the reduction of intussusception and passes a soft brown stool. What intervention should the nurse do? Make the child NPO, send the stool for analysis, ask the parents what the child ate, or notify the healthcare provider that he passed stool. All right, this one is a little bit tricky. Does anyone remember what intussusception is? So this is a condition and it's part of the GI tract, and it's described as when the colon telescopes itself. So you imagine you have like different segments of your large intestine, and one segment pushes into another segment and it causes an obstruction. Usually when they have intussusception, it's very, very painful, and they pass what's called current red jelly stool. So it's kind of like this gelatinous red stool that looks like jam. And it's very, very painful. Sometimes it spontaneously resolves where the intestine kind of clogs itself, one section pushes into the other section, and then the colon relaxes and it stretches back to its normal size. So if you have this soft brown stool, that's a normal stool. So maybe this child doesn't need to have it reduced. Reduced is going to fix it. So this is why you would need to call the healthcare provider, because maybe there's been a change. Maybe it's one of those intussusceptions that spontaneously resolved. So you need to make sure the healthcare provider know that he passed a stool. So when they have the intussusception, it causes a transient sort of obstruction, and it's very, very painful. They have like terrible intermittent body, abdominal pain. They scream and they cry, and then it kind of gets better when the obstruction kind of relaxes. And sometimes it can totally just fix itself, and they don't need to have a reduction surgery. So there's two things: they can do surgery, and they can also do what they call an air enema. So sometimes they can push air up into the colon, and that causes it to release itself. So there's two different types of reduction, but so it can be spontaneous, they can do an air enema, or sometimes they have to do surgery. Okay, so select all that apply. What foods are appropriate to introduce to an infant after they are 6 months old? Sliced beef, pureed fruit, fruit juices, whole milk, rice cereal, or strained vegetables and/or. Okay, so a couple of you chose the fruit juices. So this is kind of iffy. This is kind of paying attention to words. So foods, and technically, fruit juice isn't a food. You want to do juice in very, very small amounts also. But these other ones, pureed fruit, rice, cereal, and strained vegetables. So sliced beef, they don't really, a 6-month-old, they don't really have teeth or whatever. They can't really eat beef. And then we know whole milk. When do you introduce whole milk? 1 year.
More.
Yeah. A mother says that her child with spina bifida sneezes and gets a rash when playing with balloons. What allergy might this indicate? Latex, dust, pollen, or mold? So very good. So the clue here is balloon here. So most balloons are latex. And also, latex allergies are something that you see in healthcare. And so you should be worried whenever anyone says they get a rash when they're touching something that's latex. How can you reduce an infant's risk for otitis media? Give antibiotics as soon as the child has cold symptoms, have the child in an upright position for bottles, avoid getting ears wet when bathing or swimming, or clean the external ear canal daily. Okay, so do you guys remember there's the otitis media and then there's the otitis externa? What's the difference between the otitis media and the otitis externa?
Media is middle ear infection.
Middle ear, it's on the other side of the tympanic membrane, and then the otitis externa is going to be the ear canal. Very good, Gabrielle. So avoid getting ears wet when bathing and swimming, and clean the external ear canal daily. This is going to be more interventions to prevent like the infection between the ear canal before you get to the tympanic membrane. Upright position for bottles. So sometimes if they're not in the upright position, it can change their pressure in the eustachian tube when they swallow. So the main thing with the eustachian tube is it's shorter and wider, so they don't drain the fluid from their inner ear as well. So that sets them up for an infection. Also, when they're not in an upright position, you can then get milk down into your ear canal because they are more likely to kind of dribble out. And then if you get milk down in there, it can also be a setup for an infection. So you don't want to give antibiotics as soon as they have cold symptoms, as soon as they have ear infection symptoms, but you don't want to be overusing antibiotics. So in adolescent, psychosocial development focuses on what? Being industrious, establishing a sense of identity, achieving intimacy, or developing initiative. So good. Which theorist is this focusing on? Right from the beginning of class.
Identity versus inferiority.
Yeah. So identity versus role confusion. This is going to be Erickson. Yeah, so very good. So just remember for the HESI, there's, Erickson, Piaget, Colbert, Freud, all of those are options. They could still be on the HESI, those theorists that we studied from the very beginning of class. So a 10-year-old is in the acute phase of rheumatic fever. What activity is appropriate for the nurse to schedule? Playing ping pong, reading, going to the playroom and climbing on the fort, or ambulating without restrictions. Right, so this one was trying to get you to think about, so acute phase of rheumatic fever, do you think they're still contagious? Yeah, so if they're in the acute phase, you can't have them out doing things with other kids. So that's why the red, the blue, and the green are not. So they can hang out in their room and read. unfortunately. Watch TV.
Wait, that's not the answer it said.
It's not the answer it said? Hold on just a second. I'm
I don't know if you
sorry.
could go back.
Yeah, let me take a look here. Let's do this
That's
one
why
first.
I
and then-
was confused.
Okay, let's, so thank you. That is my interpretation. I will look at this after class and I'll send you a follow-up, because if he's acutely sick, then he should not be hanging out with other kids.
Yeah, I
So
think the
thank you.
correct answer it said was ambulation without restriction.
Yeah, yeah. So I will fix that for the next class. Thank you guys for pointing that out. So this one we'll just look at so that we can stay on track. You guys didn't get a chance to answer it. An adolescent is very depressed. What finding might indicate a risk for suicide? So excessive talking, sleepiness, history of drug use. So a preoccupation about death is probably, you know, the best answer. Obviously, like sleepiness and history of drug use could be signs of depression, but not necessarily suicide risk. So just so you know, I will look at that question, but I will also give you guys access to the COOT so you can practice this at home when we're done. Okay. So a child is admitted with depression. What finding is most significant for confirming depression? Irritability, sadness, recent weight gain, or general fatigue? So, yeah, generally sadness, you know, general fatigue is kind of something could be off. Do you expect weight gain or weight loss with depression? You're more likely to have weight loss, and then irritability, that could describe any teenager. So good job. So why would you mix an iron supplement with orange juice to deliver the dose? The iron tastes better, it looks better, vitamin C helps with iron absorption, or iron is activated by orange juice or food. So good, yeah, vitamin C helps with absorption. Good job. So what would you expect to see when assessing a child with impetigo? Small brown, benign lesions, honey-colored crested lesions, soft, wet, serosanguinous blisters, or circular lesions? All right, so this was kind of a mixed bag. So for impetigo, I always think it's good to sort of remember what's different about a disease, because a lot of times things will have a lot of similarities. So impetigo is really the only thing I can think of that is definitely associated with this honey-colored crested lesions. It's kind of like a yellowish color. And the intervention is to gently wash those off and to also treat with antibiotics. It's very, very contagious. It can spread easily among kids. So a school nurse has a 7-year-old with an asthma attack. He cannot speak, is cyanotic, and has decreased in shallow sounds. What is the nursing priority? Monitor the child with a pulse oximetry, call the parent or guardian, prepare to ventilate the child, or send the child back to the classroom. All right, so a lot of you got this right. So if you're a school nurse, though, how are you going to prepare to ventilate? What are you going to do? I think you're going to call 911. This kid, you know, cannot speak, cyanotic. He's going to need something beyond what the school nurse could do. So to think through the process, you're not going to send him back. You know, you might put a pulse ox on, but if they really can't speak and they're turning blue, then you need to be thinking about advanced interventions. So an infant develops arm leg movement before fine motor finger skills. This is an example of what pattern of development? Cephalcaudal, extremity movement, proximal distal, or pedal movement? All right, so this was kind of mixed. So proximal distal, so the two that we talked about in the beginning of class are proximal distal and cephalcaudal. Can someone give me an example of cephalcaudal development? What happens before what?
Anyone in the head like this developed before, like the head movement or something like that?
Yeah, so you get head and neck control before you get really trunk control. So that's going to be, so the head develops, and then, so that's cephalcaudal from head to trunk, head first, and then proximal distal, the trunk before the extremities. Those are the two main development patterns that we see in infancy. So status post cardiac catheterization 2 hours ago via a right femoral artery, which finding would indicate arterial obstruction? So you're the nurse taking care of this patient that came out of the cath lab. Blood pressure trending down and increased heart rate. Right foot cool, pale, and blanched. Distal pulse on the left foot weaker than the right, or pressure dressing wet with blood. So, right, so this is the right femoral artery. So the right foot is cool, pale, and blanched. So if you don't have good flow through your artery, you're not going to get blood flow down to that foot. So this one has the distal pulse on the left foot that's weaker. That's not going to correspond to the right femoral artery being accessed. Pressure dressing wet with blood. That doesn't necessarily indicate an obstruction. You need to keep an eye on that. And then the blood pressure trending down and increased heart rate. That doesn't really give you a lot of information, but this would be a concerning find, but not specifically for right femoral artery obstruction. So we have an obstruction in your femoral artery, you're going to be having decreased perfusion distal to that artery obstruction. So a toddler with a spica cast from a motor vehicle accident wants a toy. What is the most appropriate toy for a toddler? A squeaky duck, doll and clothes, handheld video game, or soft hand puppets? All right, very good. So the one that is the only one that I can say that is obviously not for a toddler is going to be the handheld video game. But you know, soft handheld puppets, he can talk with each other, and you can also play with them. The doll and clothes, kind of depending on what the toddler likes, and the squeaky duck, that would probably be a kid that's a little bit younger. So an infant with tetralogy of Fallot suddenly goes cyanotic and hypernypic. What is your priority action? Place the child in the knee of the chest position, give IV fluid bolus, apply 100% oxygen via non-rebreather mask, or administer morphine sulfate. So when they have these hypercyanotic spells, can someone tell me what's happening inside their body that causes that to happen when you have tetralogy of Fallot? Do kids that have tetralogy of Fallot, do they have normal pulmonary blood flow, or is it decreased?
Decreased.
Decrease. So there's a problem on their right side of the heart where they have a hard time getting blood from their right ventricle to their lungs. So when they have a TET spell, that's what's happening. They're not getting blood flow to their lungs to pick up oxygen. So you put them in this knee to chest position because it forces venous return back to their heart. So when you do that, you force blood back to the right side of the heart, and then it can pop across the obstructed pulmonary valve and go to the lungs. So this is your initial position. you might give fluid, because giving fluid can also increase the volume, the pressure that can go across the valve. Sometimes you give morphine to help them relax, because sometimes that happens because they're so tense and taut. But your first intervention is going to be this knee to chest position. And tetralogy of Fallot is always on the HESI, and it's always on the NCLEX. And this is your priority nursing intervention if they have a TET spell. So a child with DKA, diabetic ketoacidosis, has Kussmaul respirations. This is a compensatory mechanism for what acid-base alteration?
Don't remember.
Metabolic alkalosis, respiratory alkalosis, metabolic acidosis, or respiratory acidosis? All right, so this one was a little bit trickier. So diabetic ketoacidosis is a metabolic acidosis. So Kussmaul respirations, who can tell me what Kussmaul respirations are? What does the patient look like when they have Kussmaul respirations?
Is it the rapid breathing followed by periods of apnea?
So they don't necessarily have rapid breathing. They do have rapid breathing, but not by periods of apnea. That would be something more like your regular respirations that you would see with increased intracranial pressure. So
Okay.
Kussmaul respirations, they're just very, very deep, fast breathing. So they're breathing off a lot of their CO2. So when you have an acidosis, you compensate by trying to get rid of excess acid. So CO2 is an acid. So if you have a metabolic acidosis, you compensate for that by just breathing off as much acid as you can to try to bring back your pH to normal. So in terms of, studying for the HESI and the NCLEX, you should remember that DKA is a metabolic acidosis and that you compensate for that with a respiratory alkalosis. And then we talked about vomiting and diarrhea. Does anyone remember, does vomiting cause a metabolic acidosis or a metabolic alkalosis?
Acidosis.
Acidosis.
Okay, so tell me why you think why vomiting you think is an acidosis.
I think it's
Alkalosis. I'm sorry.
Alkalosis.
Okay, because you're vomiting acid, right? You're losing too much acid. Okay, and then diarrhea, you lose base out the butt. So when you have diarrhea, you end up with an acidosis, and when you have vomiting, you have an alkalosis. So I would probably, even if you don't really get into the weeds of like really, studying a lot of blood gases, I would pick some key disorders like DKA is metabolic acidosis, and remember that. Okay, so in terms of pH, what is an example of an acidotic pH? What's a normal pH to start with?
7.35.
Below 7.35.
Right, so acidosis is a lower pH and an alkalosis is the higher pH. Good job. So a child is admitted with persistent vomiting and NG tube is inserted. What findings should be reported to the healthcare provider? A gastric output of 100 milliliters during the previous shift, 7.44 pH on arterial blood gas, intake of 800 milliliters and output of 400 milliliters during your shift, or a serum potassium of 3.1.
No idea.
So yeah, there's a lot of going on in this question. So admitted with vomiting and they put it in NG tube. So if you're putting in an NG tube for vomiting, you're going to kind of get stuff out of their stomach so they don't continue to vomit. So this is an electrolyte abnormality that you would be worried about, right? Because once you start having problems with your potassium, you can start having problems with your cardiac rhythm, etc. This other stuff, really isn't that concerning. Like an output of 100 milliliters isn't that much. They had 800 in and 400 out. that's not really a problem. And this is like you're getting up to the upper end of normal for your pH, but the one thing here that's off is this low potassium. So which food are appropriate for a child with celiac disease? French toast, garlic bread, rye crackers, or creamed corn? All right, kind of a mixed bag. Most of you got it right though. So what is the type of food that celiacs cannot eat?
Gluten.
Gluten. So toast, unless it's gluten-free bread, garlic bread, these are going to have gluten. Same with rye. So corn does not have gluten. So cream corn is something that a kid with celiac can eat. So mom hides a toy under an infant's blanket. The infant looks for this toy. What is that called? Object permanence, object prehension, cooperative play, or separation anxiety? So most of you got that. So object permanence, this is something that you see. Does anyone remember about what age you would start seeing this?
Is it 6 months?
Yeah, very good. So you're not going to see this in the brand new newborn, but around 6 months, they start noticing when things disappear. While measuring head circumference of a 3-month-old infant, the nurse notices an increase in 5 inches. What action should be taken next? Measure head to toe length, place the findings on the growth chart, palpate the fontanelle for firmness and bulging, or check the pupils. So I totally understand why you would say check the pupils. What you're worried about increased intracranial pressure. So to be honest with you, I'm not the one that made this cute. So I think priority, I understand. I would agree with you that it would be check the pupils. You're going to palpate for firmness and bulging to see if you can see any increased, if that you can see that it's getting bigger. So for those of you that chose check the pupils, I agree with you. You would also be checking the fontanelle, but your first thing, you would probably take a look at the eyes. So a 3-month-old with GERD has lost weight from the last appointment. How can you increase calories and decrease vomiting? Small frequent feedings, start baby food, each feeding, offer high sugar juices with feedings, or thicken formula with rice cereal for each feeding. So small frequent feedings does help with GERD. You do need to talk to the doctor. Sometimes they will put a little bit of rice cereal in because if it weighs more, then they're less likely to vomit it. So this is something that specifically if they're having problems with GERD, this is something you would need to talk to the doctor about before you did it, though. You don't want just them adding some rice cereal. And also, 3-month-old, we don't normally start rice cereal until they're 6 months. So I understand why a lot of you chose the small frequent feedings. But in terms of increasing the calories, you get a little bit more calories with the rice cereal. And it does kind of weigh in their stomach and they're less likely to vomit it up. There's actually a formula out there that's called like Infamil AR, which is Infamil added rice, that they can get like pre-made that has that little bit of rice cereal in there. So this is something that you're not going to just do on your own. You would have to have the doctor's permission to add a little bit of rice to the cereal, and they would have to know how much if they didn't buy the pre-made added rice formula. What is the most important reason for implementing discipline for infants and toddlers? Children need to learn to deal with authority. Children need help developing social skills. They provide child with a sense of security, or this age child fears loss of self-control. So this is kind of tricky. They do provide child with a sense of security, which is important. They do fear loss of control, but the discipline isn't going to necessarily help them get over that. But that sense of security, like having a routine, having a bedtime routine, having a mealtime routine, or getting out of the house routine, all of those things you do with a toddler helps them have that sense of security that they need to develop their autonomy. Caitlin, you're doing great. So a newborn is noticed to have hypospadias. The parents want to know when this should be repaired. Repair is done within the first months to decrease UTIs. Should be done when the child is sexually mature. Delay until school age because of castration fears. Typically done before potty training. So there was a little bit of a mixed bag. So it's usually done before 18 months. So before potty training. I understand why you would say this because of the, to decrease the risk of UTIs, but they usually wait till they're a little bit older. So, risk of anesthesia, et cetera. So let them get out of that initial newborn period, but before they start potty training. Does anyone remember what hypospadias is? Do you see it in boys or girls?
You see it in boys.
Okay, so yeah, it's where, so normally the urethra comes out the middle of the penis, and in hypospadias, it comes out the
Bottom.
bottom, and in epispadias, it comes out the top. So it's like, it's kind of the end point of your urethra is misplaced. And sometimes they use the foreskin to repair it. So they don't recommend that they get circumcised right as a newborn, because they can sometimes use that foreskin to repair the urethra. So what would be the drink of choice with a child with sickle cell disease on a hot summer day? A milkshake, lemonade, Diet Cola, or iced tea? So I'm not going to lie to you guys. I do not get this question. So sickle cell disease, you want to make sure they're staying hydrated. I'm going to say that things like a milkshake have like a lot of sugar. You might increase your urine output. Iced tea has caffeine, would probably increase your urine output. Diet Cola also could make you pee more, where the lemonade is just going to be like kind of equivalent to something like water, or something that doesn't have like a lot of sugar or caffeine. So that would be the best option. But
Lemonade has a ton of sugar.
oh yeah, I mean, I guess it depends on how you make your lemonade, right? Yeah, so I'm not gonna lie, I would not spend too much time thinking about this. What is the main thing that you need to remember for sickle cell disease? What do you want to make sure that you want to make sure that they stay hydrated, right? So they're less likely to form blood clots if their blood is nice and lubricated. So if they're ever coming into the hospital, you're going to make sure that you get an IV and they're getting their IV fluid. So for when you're studying with sickle cell disease, I would have a general understanding of what it is. And then one of your primary nursing interventions is to make sure they stay hydrated. All right, select all that apply. An infant with diarrhea is lethargic. What assessment finding would be consistent with dehydration? Tachycardia, decreased blood pressure, prolonged capillary refill, or increased urine output? And you can choose more than one. So very good. The only one that really isn't is increased urine output. So if you're dehydrated, your urine output is likely to go down because you just don't have the same, pressure and volume going to your kidneys. But tachycardia, increased heart rate, decreased blood pressure because you've lost too much fluid, prolonged capillary refill, you don't have the same blood pressure volume going to your extremities. So very good. So a Chinese child just finished treatment for pneumonia. You notice round bruise-like blemishes on the chest. What is your priority nursing action? Look at the antibiotic used, ask if the child had an accident recently, report suspected child abuse, inquire about use of alternative methods of treatment. Yeah, so this, different ethnic groups can do some different treatments. Sometimes they can do something called cupping, where they kind of use a round cup and they kind of pound on the chest. They can also do it on the back. So, think about it. If it's like a bruise that's not, this is like a round bruise. So if you're seeing multiple, this kind of makes it sound like the same thing was used over and over again. So just kind of try to think about what's going on. You might still suspect child abuse, but you would ask some questions before you reported it. So what statement indicates understanding of the mode of transmission of Lyme disease? I have to wear long sleeves and pants when I'm hiking around the pond. I need to wash cuts and scrapes right away. I will cover my mouth when too much dust is blowing. I will not swim in still water. All right, so this one is a little bit, you have to understand what the author was thinking here. So how is Lyme disease transmitted? What is the insect, or what passes it on?
Mosquitoes.
Ticks. So it's ticks. So these other ones, scrapes right away. It's not like a bacterial infection. It's not about dust. Swim water. I mean, but really it's usually when you're hiking in the woods and stuff like that where you get ticks. So you worry about Lyme disease when you're in an area where there's deer ticks. How can you prevent a diaper rash on a 4-month-old? Use a generous portion of baby powder. Wash diaper area with soap and water every 2 hours. Use a cloth diaper instead of disposable for overnight. Use a barrier cream that does not need to be completely removed with each change. So good job. So the cloth diapers actually they stay more moist. They're more likely. You don't really need to use a lot of baby powder. You don't need to wash that often. So when they have that barrier cream on, you need to wipe off, you kind of pat it to get all the stool, et cetera, off, but you don't need to, if it's really, really sticky, you don't need to take it completely off. Go ahead and let them have a little bit of protective barrier from the butt balm. How do you evaluate the effectiveness of thyroid therapy in a 5-month-old infant? Turn from abdomen to back and cools frequently, uses reflex grasp, lifts head but does not roll abdomen to back, or does not coo or make noises. Now, this one's a little bit tricky. So what is the what could happen if you don't have enough thyroid stimulating hormone in infancy? For all people, it affects your metabolism. But what specifically can happen to an infant that doesn't have their thyroid hormone regulated appropriately? So it can cause mental retardation. So this is one of the reasons why hypothyroidism is so important. So if you have a kid that is not growing appropriately, or you have any concerns about it, it's on the newborn screen. So if they're born in the hospital, they would likely get tested, and they're born and you would know, but there's always the possibility that newborns will be undiagnosed with hypothyroidism. So if they have their thyroid medication, then they should be developing normally, assuming that it is an effective dose. So that is what I want you to understand about this question, is that thyroid therapy is needed. It's very important in infants, because if they don't have a normal thyroid level, then it can lead to permanent mental retardation. So I think this is worded strangely, and I'm not going to spend too much time in the answers, but the thing that I want you to remember is that if you don't have adequate thyroid levels and you're an infant, then that can lead to permanent brain damage. So a 3-year-old child with congenital heart disease, his pulse is getting slower over the past several hours. What else needs to be reported immediately? an oxygen saturation of 94%, a respiratory rate of 24, urine output of 20 milliliters per hour, or a blood pressure of 70/40. So this is one where you need to make sure that you're paying attention to, what is normal and what is not normal. So an oxygen saturation of 94% is probably normal. A respiratory rate of 24, that's okay. Urine output, it kind of depends on their weight. It's usually 1 milliliter per kilogram per hour. So 3-year-old, 20 kilos. But a 70/40, is that a low blood pressure for a child that's 3? Is that low, high, or normal?
Low.
It's low. So this is something that you're gonna make sure that you report immediately, and this would be, for any 3-year-old child. So good job. So a toddler needs a lumbar puncture for possible meningitis. What teaching should the nurse provide? Describe the sideline knees to chest position for the procedure. You may hear clicking sounds during the procedure. No restrictions once procedure is done. Nothing to eat or drink for 8 hours after the procedure. Yeah, so you want to try to make sure the kid knows what's going to happen. So they're going to lie on their side with their knees to the chest. This is just trying to get out, being, making sure the kid understands. A toddler is going to be able to understand what you're talking about when you say they have to lay on their side. So parents want to have more children after their son was diagnosed with Duchenne muscular dystrophy. How does the nurse reply? DMD was caused by a viral infection. Birth trauma caused the muscle weakness. The XXX muscle group has lack of protein dystrophin from the mother. DMD is an inherited X-linked recessive disorder that affects males. Oh, you guys, very good. So it is an X-linked recessive disorder that affects males. Good job. So they would need some fertility counseling. Maybe the mom could use donor eggs and her husband's sperm or something like that. They would have to talk about how they wanted to proceed. Very good, you guys. You find a child unresponsive and you yell for help. What action should the nurse take next? Check the pulse, deliver 30 compressions and 2 breaths, give 2 breaths and make the chest rise, or feel for the carotid artery and check for breathing. So this is kind of getting into your basic CPR. You kind of run over, you take a look. For kids, you focus more on respirations because it's almost always respiratory. So you're gonna probably be doing all of these things, but because it's a kid, you want to do a quick respiratory because almost all arrests in kids are going to be respiratory. So this is just getting back to your priority intervention. I know when you do like basic CPR, they have you run over and check the pulse. But that kind of generally speaking is for adults that normally have primary cardiac. So a kid, you're going to come over and see if you can evaluate the respiratory status, et cetera. And I understand why that is confusing. And I will think about some other questions and make another Kahoot that I'll share with you that kind of go over your priorities for basic CPR, because I think you do need to know that for your HESI and your NCLEX. So a two-year-old children are playing. What type of play would you expect? Associative, parallel, cooperative, or therapeutic? Good job. So who can tell me what parallel play looks like?
When they're playing next to each other, but not necessarily with each other.
Yeah, they might both have blocks and they're both building a tower, but they're not building a tower together. Very good. So an adolescent with type 1 diabetes checks his blood sugar before bed and it's 60. He ate 4 hours earlier. So what is the intervention? Bedtime snack or graham crackers with peanut butter and milk? Give glucagon, go to sleep, or glucose level unreliable because he did it himself. Yeah, so you guys, adolescent, he should be able to check his own blood sugar level. You want to make sure a blood sugar of 60, you know, make sure he gets some more carbohydrates before he goes to bed. So a 4-year-old with an NG tube states, I am going to throw up. What should the nurse do? Notify the physician, give the child an antiemetic, have the mother calm the child down, or irrigate the NG tube to maintain patency. So I certainly understand why you might think about giving the antiemetic because you don't want them to vomit. If they have an NG tube and it's patent, you know, hopefully you can get that out so they don't have to vomit. So irrigating the tube to make sure it's working is kind of your first intervention. Then assuming that it is working, you can give them the antiemetic so they feel better. But if they have the NG tube and it's patent, you should be able to get that, whatever's bothering them, out. What foods should you restrict from a child? I'm sorry. I don't know what CRF is. So I'm sorry. I will find out and I'll put it in the announcement. So I can't educate on that one because does anyone know what you think CRF means?
They probably meant to put CHF, maybe.
Maybe.
I was thinking chronic renal failure.
Oh, Reese.
You're absolutely right, Reese.
Very good, Reese.
Then you
Yeah,
gotta give them
so-
protein. There we go.
Yeah. Very good. So you worry about protein with chronic renal failure. So good job, Reese. Thank you. So signs of meningitis in an 8-year-old include Cullen sign, Koplik spots, Kernig sign, or Chavitsky sign. All right, so one of you got it. Good job. So I don't think colon sign is anything. Koplik spots is the rash that's associated with mumps. Chavitsky sign is associated with your calcium level. It's kind of when you treat the cheek, and the Kernig sign is when you like lift their head up and then they intensively bring their knees to their chest. This is the one that you use to assess for meningitis. Kernig's in Brudzinski, I think. So a child received an irreversible head injury after struck by a truck. Who should approach the family for organ donation? The nurse manager, the transplant coordinator, emergency room department nurse, or a pastoral staff member? So I think this is just trying to get at, it should be somebody that's experienced with organ donation, that's talked to a lot of families, that kind of knows the whole process. And in most hospitals where they do organ procurement, there is a transplant coordinator that has that experience that's really needed to deal with families. So personal protective equipment for a child diagnosed with SARS includes gloves, gloves and gown, gloves, gown and mask, gloves, gown, mask, and eye goggles or eye shield. So good job. You want the whole thing, including the shield and the goggles. What finding would you see in a child with celiac disease? A concave abdomen, bulges in the groin area, a protruding abdomen, or a large abdominal mass? All right, so protruding, they kind of have some abdominal distension if they are exposed to gluten. So concave, not concave. Bulges in the groin ring, this could be like a hernia. A large abdominal mass, no, it's just kind of generalized abdominal extension. So a 3-month-old just had cleft lip repair. To prevent trauma, the nurse should give the infant a pacifier for self-soothing, place the infant prone, place the infant's arms in a soft elbow restraints, or avoid touching the suture line even to clean. So this is trying to get at, you don't want the kid being able to put their fingers in their mouth to get to their suture line at all. And you do need to clean it. They can have a pacifier. How would you assess fontanelles in a 4-week-old infant? Supine, prone, left lateral, or seated upright? Yeah, so when they're seated upright, sometimes if they are in one position for too long, you can get like fluid that goes to one area or the other. So kind of sitting upright, everything can drain and then you can get a good feel. So a 13-year-old girl is evaluated for possible Crohn's disease. The nurse expects to prepare her for what diagnostic study? Genetic testing, cytoscopy, myelography, or colonoscopy with biopsy? Yeah, so good job. It's going to be the colonoscopy with biopsy is going to be how you're going to definitively diagnose the Crohn's disease. So what complication of Tegretol, otherwise known as this medication, is prevented by weekly blood tests? Bone marrow suppression, meningitis, leukopenia, sore throat, or a GI bleed? So monitoring them, monitoring their blood levels to make sure that they're not developing bone marrow suppression. This question is kind of worded strangely. So does anyone recognize this medication? Do you know what it's used for? So it's seizure medication. It's an anti-epileptic. So what signs and symptoms should the parents of a child with congestive heart failure report to the healthcare provider? Fever, vomiting, sudden weight gain, or headache? So sudden weight gain, this is one of your signs of congestive heart failure that you would worry about in a kid with congenital heart disease. So sudden weight gain is the one thing that you would definitely need to make sure you report. All right, last one. Select all that apply. What instructions should the nurse reinforce to the parents of a child with application of cast for fractures of the right ulna? Call the healthcare provider if nail beds appear blue or pale. Keep arm elevated. Wiggle fingers frequently, or take Tylenol for pain. All right, good job. So all of them are correct. Very, very good. So who's Gigi? Is that Gabrielle? Who's Gigi?
It's me,
Oh, Jerry,
girly. Yes.
girly. I'm so sorry. Well, good job. So I'm not gonna lie. I didn't love all of those questions. So I have another Kahoot that's 100 questions that I think is good. So I'm gonna put both Kahoots in your announcements. The 100 question takes up obviously a long time, so I went with the 50 question Kahoot, but I think the 100 question Kahoot is also a really good resource. So I'll give you both of them. I'm gonna go ahead and give you guys a 10-minute break. And then when we're going to come back, I'm going to give you guys some discussion questions to talk about as a group, and then we'll come back and we'll talk about it. We'll definitely get out on time, maybe a few minutes early. So go ahead and come back at 10:15 and we'll start our discussion question section, okay? Hey everyone, welcome back from break. Whenever you get a chance, go ahead and flip your camera on. Thank you, everyone. So I'm going to give just another minute to let people go ahead and come back from break. So what we're going to do is I'm going to do 2 breakout rooms. I'm going to give 1 breakout room some cardiac questions, and I'm going to give 1 breakout room some respiratory questions. I'm going to give you 15 minutes to work with your group, and then you're going to come back and you're going to teach the rest of your class the cardiac or respiratory questions that I gave you. And then we'll that should give us a time to do 1 more little session, and then you guys will be done with class. If anyone wants to meet with me to go over exam 3, or if they have any questions, let me know. I'll make sure you get both Kahoots, and I'll email you out the PDF that's a HESI review also today. Does anyone have any questions about anything so far? Okay, so I'm not gonna lie to you, I'm sometimes I struggle a little bit with the groups, but I'm sure I can get you guys assigned to the right place. I'm just it might take me a minute to get everyone assigned. So I'm gonna do gender. One. Okay, so I'm going to go ahead and open the rooms. I'm going to put a message in the chat before I do this. So I'll put the room 1 questions and the room 2 questions. So room 1, you're going to be cardiac. And here are your questions. Which cardiac defects have a left or right shunt? What is the priority nursing intervention for a child having a TET spell? And which medication is given to keep the ductus arteriosus open? Okay, so I'll give you guys a second to write those questions down, and then I'll put the respiratory questions up. So just so we're clear, Antiva, Vidia, Caitlin, Gabrielle, Juralee, Helene, Jacinia, Joelle, Kiara, and Yashika. You're all in room 1, and you guys are going to do cardiac. So the respiratory questions are here. What is epiglottitis? And list 3 nursing interventions for a child with asthma or nursing education points. And what is the difference between stridor and wheezing? And which diseases do you hear each? So room 2 is Kendra, Marissa, Peyton, Reese, Samantha, Shay, Tiffany, and Trinetta. And you guys are going to do the respiratory. I'll give you guys a second to write down your questions. Okay, so I'm going to go ahead and open the rooms. I'll let you guys choose once you're in your room who wants to report back to the class, but please everyone participate. You can use your book, you can use whatever resources you want. You'll get 15 minutes to answer your questions and we'll come back as a group. Does anyone have any questions about what we're doing? Nope. Okay. Oh, Joelle. Son. Hey, Joelle, did you get a invitation to join a room? Can you hear me, Joelle? Oh, Nice. No, no, no. Bueno, sí está la cámara. Pero nada más si pasas por acá. Hi, Reese, are you guys done?
Sorry, my Zoom froze and kicked me out and
Oh, okay. That's totally fine. You were just the only one that came back. So don't worry about it. I'm going to pull them back in just a second. If you want, I can try to get you back into room 2.
no, it's all right.
Okay. Were
I
you
think we
guys
were
almost
done
done?
anyway.
You were done
Yeah.
anyway? Okay. And I'm sorry. I was speaking to my significant other who's making sure he's not on camera. But
That's okay.
okay, everyone, welcome back. I see like most people are back already. I'll give people just a couple seconds. You had 60 seconds. So just out of curiosity, do you guys like going to breakout rooms? Do you think it breaks up class? What's your opinion of that? Is it helpful, not helpful?
It's okay.
It's okay.
Mhm.
So thank you for participating. I think it's nice to get you guys a chance to talk. So I appreciate you guys putting in the effort today. So let's go ahead and start with cardiac. I'll go ahead and let your spokesperson speak to you. The first question was which cardiac defects have a left to right shunt? What'd you guys come up with?
It's the patent ductus arterius, arterial septal defect, and the ventricular septal defect. Those were
Very good. Yep, very good. So when we say left to right shunt, what does that describe?
so the opening of there's an opening, so it goes from the blood goes from left to right, right?
The blood goes from the left
Yeah.
side to the right here. So the left side is a higher pressure. It goes
That's
down a
where-
pressure gradient. So for those patients that have a left to right shunt, do they have increased or decreased pulmonary blood flow?
Be decreased, right?
So it's
Yeah.
going to be increased because you're having that blood flow that goes from the left to the right. So there's more blood on the right side, and then that extra blood goes to the lungs.
Okay.
Okay, good. So what is the priority nursing intervention for a child that has a TET spell?
To push their knees up their chest, so there's increased venous blood return, so oxygen, flow. I
Yep.
guess.
So the oxygen, so you're pushing it back to the heart. So then there's more blood on the right side to go to the lungs. Very
Mhm.
good. And then the last one was which medication keeps the ductus arteriosus open?
The indomethacin.
So the indomethacin closes it.
Oh.
The medication that keeps it open is the prostaglandin E. So indomethacin you will give if they have a patent ductus arteriosus, you'll give it and that'll close it. But there are some defects where you want that duct left open. For example, hypoplastic left heart syndrome, pulmonary atresia, where there's something severely wrong with the heart and you need that duct to be left open. And then you would put them on a prostaglandin infusion until they have their surgery. So it's good to recognize indomethacin. I'll put indomethacin in the chat. Indomethacin will close it, and then
Mhm.
prostaglandin keeps it open.
Okay, I read the question wrong. Sorry.
Oh, no, you're fine. I just want to make sure you guys know, because, yeah. Indomethacin closes the duct, and then prostaglandin. Okay, so good job. Okay, so for the respiratory group, what did you guys come up with as the definition of epiglottitis?
It's the swelling of the flap that covers the trachea during swallowing, so the food does not enter in the lungs, so it swells up, and that's what kind of.
Okay, so it's swelling right around the vocal cords. Is it a medical emergency?
Yes, definitely.
Yes. Okay. So this is one when you see epiglottitis, you need to make sure that you're thinking about intubation or maybe even a trach. Okay. What did you guys come up with, which is some nursing education points for a child with asthma?
You can set the patient up right, make sure they recognize their triggers, as far as
Okay.
like maybe indoor, outdoor allergens, or even exercise or weather can change it.
Okay.
Watch out for that tripod position when it's like they like leaning over and they're not getting a good oxygen that way.
Okay.
Yeah.
And how about what are some teaching points for how to use their inhaler?
Well, I guess it depends if it's the rescue one or the one they use every day. Because
Okay.
some might have a spacer, but I know you're supposed to wait like a couple minutes between them.
Okay.
I'm trying to
So
think.
yeah, so the spacer is important, especially if you have reports that a kid's using that rescue inhaler a lot. Sometimes they're not actually getting the medication. So what the spacer does is you put the medication in the spacer and then they breathe it in. So then it's more likely to go into their airway where they need it. If they're constantly kind of using their albuterol, that rescue inhaler, sometimes it's just getting stuck in the back of their throat. So doing a review of the technique that they're using for their rescue inhaler can help you figure out, are they just using the inhaler incorrectly, or are they really having a severe exacerbation of their asthma? Good. Okay. And then what did you guys come up with? So what's the difference between stridor and wheezing, and when do you hear each one?
You hear stridor with croup, and that's the high pitch that occurs when it's an obstruction, like in a voice box. And you use steroids to open the airway for that. And you
Okay.
see wheezing with asthma, and that's a high pitched noise, but it only occurs with expiration.
Right. And stridor is with an inhalation. All right. Good job,
Yes.
you guys. So for the next little bit, there's just a couple more questions, but I'm not going to make you guys go to breakout rooms because we're getting close to the end of class, but I'll let you guys do it as an entire group. And I'd love it if you would talk to each other. Does anyone want to be brave to be volunteer to report back your answers? I appreciate the 2 volunteers that we've had so far. I know Caitlin doesn't like to do it. Would you be willing to be the spokesperson, Trinetta? She says no. Okay. How about
It's okay,
Marissa?
I'll do it. It's fine.
You'll do it? Thank you, Trinetta. It's not, we're friends now. That's not something stressful. So I'm going to put your questions here. What is the difference between type 1 and type 2 diabetes? What is diabetes insipidus? And name 2 pediatric GI conditions that require surgery. What are they? And what is the surgery? What is the surgical repair? So you guys can talk as a class. And I'll give you like, I don't know, I'll wait till you guys stop talking. So probably somewhere around 5-7 minutes, and then we'll come back as a group and we'll go over the answers.
I'll start. Type 1 is usually treated medication. Type 2 is more of a lifestyle kind of.
I know type 1 doesn't make insulin.
And then with type 2, the pancreas doesn't produce enough.
Right.
Diabetes insipidus is obviously the urinating too much.
And it's drinking too much water, so you're throwing your body into a diabetic phase.
You guys talking about diabetes insipidus?
Yeah,
It also doesn't have to do with sugar.
yeah.
Yeah, it's like too much of the ADH hormone.
And what was the other?
EI. Kids. Right? Is that what it was?
GI conditions that require surgery. And what is
Appendicitis.
A hernia.
Intussusception.
Reese, repeat that one again.
Intussusception. When the colon and stuff goes inside of itself.
Okay.
That needs surgery.
Pyloric stenosis is one.
we only need 2. And then just the name of the surgery. Like, what is the surgical repair? Or I guess, what happens?
Pyloric stenosis.
Okay, I feel like I hear some quieting down. Are you guys done? No, Trinetta says no. You guys need some more time? Okay.
Trinetta, what are we missing?
The procedure for, I guess, pyloric stenosis, or whichever other one we did. I did the procedure for intussusception.
Pyloric stenosis, it's a pyloromyotomy.
There we go.
Yeah. And it's basically an incision in the wall of the pylorus, and it opens a channel from the stomach to the small intestine, or closes it.
I was having a hard time pronouncing the word.
It divides the thickened outer muscle while leaving the of the pylorus intact, specifically. So
Okay, so whoever said what it is, can you repeat that one more time?
just the word, or like what it is?
Everything that you just said.
Okay, so it's the operation divides the thickened outer muscles while leaving the internal layers of the pylorus intact. And so it's basically just an incision in the wall of the pylorus, and it's a pyloromyotomy.
So I might have hung you up on the, what is the surgical repair? So are you guys done with most of it, or what are you working on?
I think we're done.
Okay, perfect. So what did you guys come up with, Trinetta, for the difference between type 1 and type 2 diabetes?
Type 1 is where the body doesn't make any insulin and is treated with, of course, medications.
Like insulin. Okay,
like
very good.
insulin. Type 2 is where the pancreas doesn't produce enough insulin and it's normally treated with diet and lifestyle modifications.
Yep. So, and it's also there might be some for type 2, some degree of insulin resistance, that the cells are not as receptive to the insulin. And it does have to do with like body mass, right? So you're going to see type 2 more often in kids that are obese and have a sedentary lifestyle. So with kids, you're going to start with diet and exercise modification. With adults, you'll probably start diet, exercise, and also some oral medication like glucophage that kind of helps with insulin resistance. All right, very good. And then I realized that this auto-corrected me, so hopefully you understood what I meant. So what is diabetes insipidus, or DI?
DI is a condition where there's too much antidiuretic hormone. So there's a lot of urine output.
So you're very, very close. So antidiuretic hormone,
sorry, not antidiuretic, because that makes you not pee. It's not antidiuretic.
so it is still, right. So there's syndrome of inappropriate antidiuretic hormone, which is SIADH, and then you don't pee enough.
Yeah.
So DI, it's the same hormone. I have to think through this in my brain. So antidiuretic hormone, I think you were right.
Diabetes insipidus, you don't have enough ADH. You're not producing enough, so you're peeing too much.
And then in SIADH, you have too much and you don't pee at all. So they're the same hormone, but they have the opposite effect. Very good. And then what did you guys come up with, the GI conditions that require surgery in childhood or infancy?
We came up with intussusception and pyloric stenosis.
Very good. And there's another one that we talked about in class.
What was the other one we said?
There's another one that's called the transesophageal fistula. Does anyone remember what that is? So that's where there's a connection between the trachea and the esophagus. So this is, you'll see this in kids when they sputter when they eat, because they're getting their milk into their lungs, so they're at risk for aspiration. So this is one that you'll see right when they're born. When they're first eating, they sputter and they have a hard time breathing because their milk is falling into their lungs. So they have to go in and close the opening between the trachea and the esophagus. Okay, there's yeah, I think those are the main ones. Does anyone have any questions? No? Thank you guys so much for participating in class. I really appreciate all of your hard work. This is the last time you have to come to class. So you guys schedule your HESI. You need to, if you have any questions, please schedule an appointment with me. I will happily meet with all of you at any point in time. If you want to go over your exam 3, if you have any questions about the HESI, any questions that you have, just send me a message and I'll schedule a time to meet with you. And then good luck. If I would love to, hear how everyone did and touch base with me and let me know if you have any questions. And I really enjoyed working with you guys this term. So please let me know if there's anything that I can do to help you get ready for your HESI. Okay.
Thank you.
You guys have a good day. I'll see you later. Bye-bye.
Thank
Oh,
you.
I won't necessarily see you later because today's the last class, but bye-bye.
Bye.